Then I just wanted to introduce to this concept of calcium scoring on the CT scan, because we want to have some imaging modality which can give us an opportunity to identify patients who are having coronary artery disease. So calcium CT scan scoring of the coronary arteries has come out as a one important imaging modality, especially patients who are intermediate risk or who are diabetics. And if you do their calcium scoring, and if there is no calcium, then it has been found that your annual mortality is less than 1% over a period of 15 years. However, if you have a calcium score more than 300, you are a high risk patient, and your chances of getting into a coronary even are more than tenfold. So, but the importance of calcium on the CT is more in identifying the disease. लेकिन ये identify नहीं कर पाता है कि कौन सा patient unstable है, who will likely end up into a cardiac event, or who's somebody who will go on to have a stable angina. But importance is कि अगर एक diabetic patient है और आपने उसका coronary CT कराया and you found that there is significant calcium, you should become aware कि अगर आप asymptomatic भी हैं, you don't have angina, but then there are chances that you may be having atherosclerotic disease, or आप preventive lifestyle factors, drugs like statins should be introduced in the treatment protocol. So that is the importance of doing a coronary CT scan. And I think over the time in recent few years, दो important trials हुई थी, courage and fame trial, जिनमें stable angina के patients को randomize किया गया था या FFR की technique से देखा गया था. Then it was realized that if you are a stable angina patient, then doing aggressive angioplasty may not really be much beneficial, or एक optimal medical treatment may also be equally good as compared to offering a angioplasty in these patients. So of the recent years, the trend has changed that if you are stable, आपको कोई बहुत rest angina नहीं है, बैठे बैठे pain नहीं है, then maybe trying to optimize medical treatment and increasing your lifestyle correction factors may be equally helpful. Only if you have severe symptoms, if there is a sudden worsening of your symptom, if you are not controlled despite medical treatment, और आपकी coronary angiography पे anatomy ऐसी है जो बहुत high risk है, left main है, proximal LAD है, या आपका cardiac function compromise हो रहा है, then these are the subset of patients where we probably need to rush for doing an intervention. Otherwise, our effort should be on trying to optimize them on medical therapy. So the important take-home message from here is that there have been now a lot of advancement in identifying vulnerable plaque, or our attempt is to find out these unstable lesions, and subclinical plaque rupture happens often, or our focus is not only to stabilize the plaque, लेकिन अगर आपके blood के thrombogenic factors को हम improve कर सकते हैं, अगर आपको blockages हैं but आप regular exercise करते हैं तो आपका myocardium की ischemic preconditioning हो जाती है, then God forbid when you have a heart attack, you may not have an arrhythmia and you may not die of a heart attack even when you have a heart attack. So ये सारी चीजों को हमें understand करना है, science को understand करना है, and we have to focus that we are promoting lifestyle changes and interventions besides coronary interventions to stabilize our patients. Another thing which is very important is the role of stress in our and how it affects our body, and what is the science of meditation. I think most of us suffer some or other kind of stress in our life. It could be because of a frustration, because of a blocked goal. It could be a conflict. Today, even if you have to decide to choose between which car to buy or which mobile to buy, or if you take a child to buy a toy, there is so much of conflict in his mind that also becomes a cause of stress. Then, of course, a change of workplace, frequent moving, that also needs adaptation and can add to your life stress. And the most important is all of us today talk about work pressure. And I often tell my patients, work never kills you, but your worry and desire for the result of your effort is what is killing you. So keep working, but stop worrying about the result, and you will be half free of the stress. Now, the researchers have found that once you get stress in your life, you react two ways. There are some people who are somatizers. That means their body responds to the stress, and people get stress headache. They can have irritable bowel syndrome or breathing difficulties or chest pain. All of us specialists, will have some of the patients in our OPD coming to us with these kinds of stress. The other is not our body, but our mind reacts. And uske wajah se we can have excessive anger or apprehension, anxiety or depression. So both ways the stress can manifest in our body. And according to American Institute of Stress, almost 75 to 90% of all hospital visits to a primary care physician are stress related. Koi na koi underlying stress is the manifestation of a disease. And of course, Dr. Rahul would agree that we have talked a lot about this in privately also. There is a whole new science which we call as psychoneuroimmunology. That means your emotions, your nervous system and your immune system are very closely interrelated and are responsible for the disease. Now we need to understand how does our stress precipitate the problems in our body. तो हम लोग को we were not supposed to be sitting comfortably in these air conditioned environments. Evolution के point of view से we were cavemen. तो अगर आप जंगल में थे तो आपके लिए सबसे बड़ा स्ट्रेस क्या था? सबसे बड़ा स्ट्रेस ये था that some animal was chasing you and you had to save yourself. तो जब आपको अपने को बचाना था तो what you required to run. For running, your muscles required energy. और ये एनर्जी आपको किससे मिलती? आपको वो शुगर से मिलती. सो योर लिवर रिक्वायर्ड टू प्रोड्यूस शुगर. वो शुगर आपके लिवर से आपके मसल्स में जानी है. वो कैसे जाएगी? आपके ब्लड सर्कुलेशन से जाएगी. सो योर हार्ट रेट एंड ब्लड प्रेशर गोज अप सो दैट दिस ग्लूकोज विच इज सिंथेसाइज्ड इन योर लिवर रीचेज योर मसल्स. उस समय जो आपके और बॉडी के फंक्शंस हैं, वेदर आपका इम्यून सिस्टम है, आपका रिप्रोडक्टिव सिस्टम है, आपका डाइजेस्टिव सिस्टम है, all these have to slow down because your priority is to save your life. Now this is what doctors from Harvard, Dr. Holter and Cannon, described as the flight or fright response. That means whenever there is a stimulus to our brain which signals that there is some threat, then your brain gives a message to your adrenal glands, and your adrenal glands start secreting adrenaline and non-adrenaline. और ये जो adrenaline और non-adrenaline बनता है, ये आपके लिवर में ग्लूकोज बनाने लगता है, ये आपके हार्ट एंड ब्लड प्रेशर को बढ़ाता है, आपकी मसल्स को टेंस करता है. Your pupils become tunnel vision because to save yourself you should be able to see well. You start breathing faster. So ये सारा cascade होता है as a response to a perceived threat. आपका digestive system slow down होता है because you are running and you are producing lot of heat. तो आपका hair का erection होके heat loss होता है through your skin surface and you start sweating. Your bladder muscles relax. क्योंकि ऐसा नहीं हो सकता कि animal is chasing and you will say, please wait, let me go and pass urine or defecate. So your sphincters have to be tightened so that you can tide over this crisis. So this is whole cascade which happens in a response to a perceived threat to your brain. Now, this is supposed to be a very protective phenomena, provided that it is happening for a short while and later on you are in your relaxed state of mind. However, over the time, we people have shifted from that cave into a safe environment. Our physical threats have gone away, but we are as human beings have power of cognition. So we can anticipate, we worry, we have anxiety. So this is very beautifully says कि अगर one daughter bird comes, the mother and father bird don't tell him, where were you all the time? I was worrying about you. But look at the human beings. All day long, our mind is giving us some or the other reason to think about, to worry about. And these stressors are not like running away from lion, because when you are saving your life, it was either a transient phenomena, either you saved yourself or you were dead. So the stress response was transient. But these mental stressors are chronic stressors, and they keep stressing your body, keep stimulating your adrenaline and non-adrenaline for hours together till your mind is perceiving that threat. And once this stress response is activated for a long time, you keep synthesizing sugar because you keep making energy for supposedly for your muscles to run, and you get diabetes. Similarly, आपका blood pressure constantly बढ़ा रहता है, and what you get is hypertension. And sustained hypertension and diabetes is the right platform to create coronary artery disease. आपकी brain functions को ये affect करता है, आपका digestive system slow down हो जाता है. So a lot of patients who have IBS, actually have underlying stress which is precipitating it, because all the time, because of your mental stress, you are activating your adrenaline and you are telling your bowels to slow down, to quieten down. Similarly, your growth is stunted, and these days we are seeing a lot of young people coming to us with infertility because constant stress से उनका reproductive system affected है, they have irregular menstrual cycles, or their testosterone levels are come, and the moment you make them work on their stress levels, suddenly the couple conceive, and they are able to have babies. So that is how you have to understand. Even your immune system shuts down, and your chances of getting infection. There was a study which was conducted where they found that students who were going to take up their exam, their chances of having viral infections were much higher than people who were age-related children who were at a safe home environment, not under this kind of a stress. So you see the list of diseases which you can guess only because you are carrying chronic emotional mental stress in your body. And I want to look at this also. Diseases like cancer or malignancies can also have a underlying stress as the cause. And it has been found that 8 out of the 10 most cancer affected organs have their blood supply cut off during stress. So somewhere this stress is producing a problem in your body. Now, we all understand that stress is causing it, but we logically want to know that is there a way to get over this and heal ourselves? So a lot of mind-body therapies or techniques have been described which can, help you to heal yourself. And this is one I am taking is because it has a scientific background, and we should be able to give scientific data to our patients to convince them that this is how meditation works. So this is Dr. Herbert Benson. He was a cardiologist at Harvard. And when he was treating his patients of hypertension, at those days, jab treatment early phase mein, there were a lot of side effects also of the medications, and he realized that many of his patients were worse off after starting drugs for hypertension. And he tried to see if there was any way that he could help his patients bring down their blood pressure by non-pharmacological means. And he developed this technique which is called as a relaxation response. Actually, a relaxation response ki technique is what he adopted from transcendental meditation from Maharshi Yoga. And unke jo volunteers the, initially he did the studies on them, and then he trained lot of people who were patients of hypertension with this transcendental meditation techniques, and produced data and studied them. And what is this technique? This technique बहुत simple है. आपको you are supposed to sit quietly in a comfortable position, close your eyes. उसके बाद आंख बंद करके आपको ये महसूस करना है कि आपकी बॉडी के all your muscles are relaxing. आप या तो ऊपर forehead से toe पे जा सकते हो, या you can come back in the reverse way, and you have to start feeling that your eyebrows are relaxing, your cheek muscles, your neck muscles. Address every body organ that you know of, and you have to feel that it is relaxing. Uske baad, you have to start breathing through your nose and start focusing on some word or syllable. तो आप अगर आपका स्पिरिचुअल बेंट ऑफ माइंड है, रिलीजियस बेंट ऑफ माइंड है, तो आप कोई भी अपने रिलीजन से एसोसिएटेड या अपनी पर्सनालिटी से एसोसिएटेड वर्ड को सिलेक्ट कर सकते हो. ओम कर सकते हो, ओम नमः शिवाय कर सकते हो. क्रिश्चियंस टॉक अबाउट जीसस. If you are atheist, you can only start speaking one, 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 one. और जब आप सांस ले रहे हैं, तो when you breathe in and breathe out, you have to only focus on your breath. Shift your awareness on your breath and keep chanting one, 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 or Om Namah Shivaya. And you have to continue to do it for 10-20 minutes. आपको ऐसा कुछ नहीं करना है कि अलार्म लगाना है. अगर आप चाहो तो एक बार धीरे से वॉच देख सकते हो for how long I've been doing it. And after you feel that I am done for the day, फिर भी you keep your eyes closed for a time and then slowly open them and then stand after a while. एक्चुअली बहुत सारे लोग जब ये टेक्निक शुरू करते हैं, तो वो बजाय टेक्निक पे या एक्टिविटी पे फोकस करने के, उनका माइंड इस पे फोकस होने लगता है कि क्या मैं इसे ठीक कर रहा हूँ, आई एम डूइंग इट करेक्टली. अरे लोग तो कहते हैं कि इसमें मेडिटेशन में रिलैक्सेशन होता है, मुझे तो कुछ फर्क नहीं पड़ रहा. सो ऑल दिस थॉट्स एंड वरीज यू हैव टू ड्रॉप. You have to have what he calls as a passive attitude, and you just have to keep doing it. आपको कुछ thoughts distracting आएंगे, over the time you will feel that you will start wondering, thinking about something related to your worldly affairs. But the moment you realize कि अरे मैं तो बैठ के ये meditation technique कर रहा था, start again doing the same activity. और over the time you will realize कि ये जो distracting thoughts हैं, ये कम हो जाएंगे, and more time you will be able to focus on your breath and on this chanting. Important thing is that you should not do it within 2 hours of any meal, because at that time your blood circulation, your digestive system requires, and it may interfere with your relaxation response. If you want, you can play a light music at the time when you are doing this meditation response. So he identified 4 important things for the components of this relaxation response. One is quiet environment. There should be silence. The other is that you need some mental device. Aap sound low, word low, phrase low, prayer low, you can whatever you. Third most important is passive attitude, and fourth is comfortable position. Over the time when he practiced this more, he realized कि सिर्फ इसमें 2 चीजें important सबसे ज्यादा है. वो है एक तो attitude, that you are not worrying, you are just relaxing and doing it passively, and you are using a mental device to focus your consciousness on this. आपको quiet environment की जरूरत नहीं है. आप चलते चलते street पे भी इसको walking meditation भी कर सकते हो. But for beginners, this is probably the right way to go about it. And what he realized was that agar ye meditation techniques hui, then the patients, when they were followed up, unka heart rate lower tha, respiratory rate lower tha, their average blood pressure was lower. On the EEG, their wave pattern was better. They were able to get alpha waves, which showed that it was more of a relaxed state. Lot of people confuse between sleep and meditation. They sit down to meditate and they go off to sleep and they feel very happy about it कि हमको बहुत अच्छा meditation हुआ, I almost got off to sleep. No, there is a difference between sleep and meditation. Meditation is conscious awareness and focusing your awareness on your breath. और इनको उन्होंने monitor किया. जिन लोगों को आप meditation करते हैं, when you go off to sleep, your metabolism goes down, but this reduces gradually over 4 to 5 hours. जब 4-5 घंटे आप सो लेते हैं, तो आपका metabolism कम होके 8% पे तक कम होता है. Whereas in meditation, this reduces to almost 10 to 20%. And this happens in only the first 3 minutes of starting the meditation. So it is very effectively calming you down and reducing your basal metabolic rate if you are doing it the right way. Sleep mein, there's no increase in alpha waves, whereas in meditation, they have been able to demonstrate that the alpha waves are increased. The third difference is that there is no change in lactate levels when you are sleeping, whereas in meditation, they have been able to demonstrate a reduction in lactate levels. Or lactate levels have been related to the anxiety states. If you have high lactate levels, then you have more anxiety problem. So all this shows us that meditation is not form of a sleep, nor it is a substitute. Meditation is a technique of relaxing and reversing the sympathetic overdrive which you are producing in your body by constant worry or activities. और ये उन्होंने scientific data भी produce किया. He took 86 volunteers who had hypertension और उनको पहले उनका blood pressure monitor किया with the routine drugs which they were taking. फिर उनको ये transcendental meditation सिखाया और उसके बाद फिर उनका blood pressure monitor किया. एंड उन पेशेंट्स को उन्होंने फॉलो अप किया जिन्होंने इस मेडिटेशन के पीरियड में कोई ड्रग चेंज नहीं करी थी और दे वर ईदर ऑन नो ड्रग और द सेम ड्रग्स व्हिच दे वर टेकिंग एंड दे वर randomized either to a group which was doing meditation and the other was a control group. And what they were required to do was 2 brief periods of transcendental meditation or relaxation response in a day. And they found that the systolic blood pressure average reduced from 146 to 137 or diastolic उसमें भी significant reduction था. And the important thing was that अगर इन patients ने ये अपना meditation stop कर दिया तो within 4 weeks their blood pressure values came back to where they had started. So this shows that if you do, your blood pressure falls down. If you stop doing it, then your blood pressure comes again. So there is a very scientific documentation done by him about this relaxation response. So there are a whole number of techniques, इतनी तरह के meditation techniques हमको बताए जाते हैं. सबका basis यही है that you have to focus your awareness on your breath and you have to just feel relaxed and this will help. So जो भी आपका temperament है, जो भी आपको technique suit करती है, one can adopt. In fact, he did studies later on young students and young college going students there. जब उस जमाने में वहाँ पर बहुत ज़्यादा drugs का marijuana और इसका usage था, and he selected these students and taught them these transcendental meditation techniques, and he was able to demonstrate that those people who were doing this TM techniques regularly, उनका LSD, marijuana use और smoking use बहुत reduce हो गया था. So this is very good and beneficial in the long term in reducing your stress and healing your body.